Hi, I'm Daniel Hershey's Espilitan. Today I'm going to perform the essential Intrapartum newborn care. It is designed to promote an evidence-based, eliminating the stereotype newborn care practices such as unnecessary suctioning and bathing instead of carrying out a step-by-step, time-bound interventions. The objectives are to for immediate drying. Second is the skin-to-skin contact of the baby from the mother. Third is the proper cord clamping and cutting. And last is the non-separation of the baby from the mother and the breastfeeding initiation. So we have here the equipments that we're going to use. 3 sets or pairs of surgical gloves, a bonnet, 2 warm blankets, erythromycin ointment. We have here 3 syringes, one for the vitamin K, the second one is for the oxytocin injection, and the third one is for hepatitis B vaccine. Also, we have here the cord care set, including the surgical scissor, the plastic umbilical clamp, and the surgical clamp. So the first 3 minutes is the calling out of time of birth of the baby and the sex, and after that you're going to thoroughly dry the baby using the first blanket from the face and head down to the extremities, while also doing a quick check for the breathing of the baby. And after that, you're going to remove the wet blanket and place the baby in prone position. So, with a skin-to-skin contact of the baby from the mother, from the abdomen or between the chest of the mother. And next, you're going to place a bonnet and the second blanket to the baby. So next is you're going to remove the first layer of the surgical gloves and dispose it. So after that, you're going to check for the pulsation of the umbilical cord. And if the pulsation has stopped, I'm going to place a plastic umbilical clamp about 2 centimeters from the umbilicus and a surgical clamp about 5 centimeters. Next is I'm going to cut the umbilical cord near the plastic umbilical clamp. Next is I'm going to inject a 10 IU of oxytocin to the mother's arm intramuscularly. So first I'm going to clean the area. Then I'm going to inject the 10 IU of oxytocin. Next is I'm going to put a bandage on the injected part. So still maintaining the skin-to-skin contact of the baby from the mother, and also checking the mother's condition. So now we're going to deliver the placenta. So check for the characteristics of the placenta, and also check for the heavy bleeding and the perineum of the mother. And next is we're going to also clean the perineum of the mother. So next is we're going to apply the erythromycin ointment to the baby's eyes. This is to prevent getting an infection if ever that the mother has sexually transmitted disease or such as gonorrhea. Next is I'm going to inject the baby with vitamin K and hepatitis B vaccine intramuscularly. Next is the rooming in of the mother and the baby, and last is we're going to perform hand washing and document all the data that we obtained and the procedure that we made, and last is to also note for any signs of complications that should be immediately reported to the physician.